The main reason why we're in this hospital, in this room, is because we might have all these statistics and all this data about obesity, diabetes, and respiratory diseases and everything that comes with an inactive life in children, but that data has been done away from the people. So we have brought ourselves here to see what really goes on in the grassroots.
To give out most of our services, involve the clinical, outpatient, also inpatient services. We are doing the outreach also services which involving the community around, and we have been doing a lot of community diagnosis. We involve the community also in part of management. The most common cases we are seeing here are the common, like the upper respiratory tract infections, yes, diarrheal diseases. Those are the most common currently. The malaria cases have really subsided so much. The most cases we are getting underweight here are the HIV infected patients who are on the medication. Those are the most common cases of underweight. Yeah.
Those are now adults?
Yeah, adults.
Yeah, but what about the children and underweight?
Children underweight, we are normally in a month we are getting like 5 cases of underweight.
What about rickets? Is that something you see here often, especially amongst the children?
Rickets is a very rare disease.
Very rare.
It's very rare.
Yes.
Yeah, I think since for the last 1 year,
yes,
I have seen one case of
case
rickets.
only.
Yeah.
Okay. What about the younger children in the formative years? Height for age, and even all the way until maybe they're in standard 7. That would be age what? 12, 13?
Actually, on that graph, it normally works within the normal.
They're within the
normal curve.
Okay.
I want you to advise someone, or advise me, on just healthy living. If I come here and I say, Dr. please help me, just advise me on healthy living.
One of the issues is exercise. Actually, we emphasize a lot of exercise in most of our patients. Yeah, and then the feeding habits. If somebody is alcoholic or smoking, we advise them to stop if possible or to reduce the rate of those.
So when you were saying that you give advice to patients on how to live better lifestyles with exercising and eating well, do you give them specific guidelines, like how much they should exercise a day or what sorts of foods they should eat?
Like in the cases of mostly the diabetic and the hypertensive cases, we normally, like we say, you are at least you walk more than 3 kilometers in a day for that exercise. Those who are overweight, maybe somebody having above 90 kgs, we advise them to do more exercises. For example, what we do for the diabetic patients, we say maybe you take carbohydrate of this rate, green vegetables of this size, and a little few pieces of protein, meat, or any other protein, common in a few pieces.
When you recommend exercises, do you recommend any exercises other than walking?
Yeah, we recommend, okay, maybe the way they walk should be variable, like maybe walking very fast in the first 500 meters and then maybe running for the next minutes, and then that way, not just in a consistent style of working.
One key thing which we found out in this hospital is that the doctor has informed us that he's prescribing exercise to people who are suffering from diabetes. He's also prescribing walking as a form of exercise to the people who are suffering from overweight and obesity, and that is something very important in managing of overweight and obesity, as exercise is something very important. He also mentioned that he manages the food intake. That means the diet management is also a key thing in managing overweight and obesity, as per the doctor in this hospital.
Visiting this hospital was extremely helpful for us because we want to make sure that our initiative is very county specific. So actually being able to come in and speak to the doctor and learn about the specific health issues of this county will help us tailor our program to the specific needs of this region and therefore make it more beneficial.